What is a liquid biopsy, and what are the benefits to patients and care pathways? To summarise the key messages in this video, a liquid biopsy is a blood test that looks for tiny pieces of DNA from cancer cells. It's less invasive than traditional tissue biopsies that take a sample from the tumour. The results can come back before traditional biopsies and help guide treatment options. NHS England is piloting this test for lung cancer patients and plans to offer it to up to 10,000 patients. What is a liquid biopsy? A liquid biopsy is a simple blood test that looks for small pieces of DNA from cancer cells in your blood. This test can find changes in these DNA pieces, called genetic biomarkers, which can help show your risk of disease, the type of disease, and how you might respond to treatment. Understanding circulating tumour DNA. When cancer cells are found in the blood, it's called circulating tumour DNA, or ctDNA. By studying ctDNA, doctors can learn about the cancer and possible treatment options. Since a liquid biopsy is a blood test, it's less invasive than traditional tissue biopsies, where a piece of the tumour is removed for testing. Why are we offering a liquid biopsy? This liquid biopsy test is being tried with some patients suspected of having lung cancer because it offers a simpler way to get important genetic information about the cancer. The test can give results before a traditional tissue biopsy, helping patients and doctors choose the best treatment sooner. In lung cancer, liquid biopsies have found specific DNA changes that can be treated with targeted therapies. This means more precise treatment options for patients. A review of the NHS pilot for suspected lung cancer. There are different types of lung cancer, with non-small cell lung cancer being the most common. NHS England has started a pilot programme supporting liquid biopsy testing for patients with suspected late-stage non-small cell lung cancer. Over 2,000 patients have already agreed to have their blood tested in this pilot. The liquid biopsy results can come back before traditional tissue biopsies, allowing earlier discussions about treatment options and clinical trials. The pilot is now expanding to include 10,000 more patients across many hospitals in England. What's involved in the test? There are 5 steps. 1. A clinical team member will talk to eligible patients about the test. 2. They will ask for the patient's permission to having their blood taken. 3. A blood sample will be taken. 4. The sample will be tested in an NHS lab. 5. The clinical team will share the results with the patient in about 2 weeks. Understanding the test results. The clinical team will explain the test results to the patient. They will talk about any genetic changes found in the circulating tumour DNA, what these changes mean, and how they can help guide treatment options. Treatment options might include tablets, chemotherapy, radiotherapy, or surgery. Like with any blood test, sometimes the test might not work if the blood sample isn't good enough. If this happens, your clinical team will explain what it means and next steps. Your local clinical team is always there to answer questions and provide support. Find out more, including a video transcript and other useful links, please visit our websites.